Welcome to KompleteCare. This system is an omni-channel platform or exchange that collapses the view of what a provider does in the interest of the HMO in one view. Here, the provider can view authorization codes and request authorization codes from the HMO. The provider can see all the HMO plans, the details of the plans. The provider can see all the enrollees. For example, this is an enrollee for Health Partners. This is another enrollee for Total Health Trust. The provider can file a claim and manage claims. The provider can also see the HMO tariff. For example, if the provider wants to see the tariff of a particular HMO, all the provider needs to do is to type the name of the HMO and then click on See List. Here, the provider can see the tariff for all secondary care procedures, medication prices, lab investigation prices, as well as radiology investigation prices. The provider can also send messages to the HMO and the HMO will receive the message at his end. For the sake of this demonstration, the provider is going to request authorization code from a HMO by imputing the enrollee ID and then putting the reason for the request. The authorization code now has been requested. The provider can also file a claim. To file a claim, the provider needs to click on this checkbox and then submit the claim. So in a nutshell, this is how KompleteCare enables the provider to work with multiple HMOs from one single interface. I will now log into the HMO side of things and show what the HMO can do. Welcome to the HMO platform. The HMO platform has a dashboard that shows important information that enables the HMO make decisions. So for example, the HMO can see the number of enrollees, the enrollee growth rates, the premium growth, the total premium collected, number of providers, the provider growth rate, the number of approved authorizations, number of claims processed, value of claims processed. You can also look at financials in terms of capitations, days sales outstanding, and then fee for service paid. The HMO can also add a client plan. You can also add a provider plan. So to add a client plan, all the HMO needs to do is to click on Add Plan and then put in the name of the plan benefit limits, the plan benefits, the premium, the plan duration. If this plan requires co-payments, the HMO can indicate and put in the deductible amount and then activate the plan. On the other hand, the HMO can also add a plan for the hospital to see. So for example, you can choose the gold plan and upload a CSV file containing all the benefits that every enrollee who has subscribed to this plan will have. What has been uploaded on this side will be seen by the provider. On the enrollee interface, the HMO can upload all enrollees by using the bulk upload function. To do that, the HMO uploads a CSV file. The HMO can also upload a single enrollee by completing these details. The HMO can also see an appointment that has been scheduled with a provider in real time. So if or when an enrollee schedules an appointment with a provider, the appointment workflows automatically to the HMO, and the HMO can see the appointment scheduled, as well as the consultation medium, whether it's going to be in person, video, or voice. In the same vein, it prepares the HMO to expect an authorization code for this patient if there is need for secondary care. On the provider interface, this is where the HMO can approve authorization codes. And I'm going to demonstrate how that is done. We can see that we have a pending authorization code here for this HMO. The HMO clicks on See Reasons, and it will see all the information entered by the provider, and then clicks on Accept to approve. Authorization code has now been approved and has been sent to the provider. On the claims interface, the HMO can customize the form, the claims form. It can also upload a claims policy, and then it can also approve provider claims. So right here, we can see that a claim has been submitted. To approve the claim, all the HMO needs to do is to click on View Form and then see all the information and the tariff, then accept. When accepting, the HMO can pay the provider in two distinct ways. The first is via the Care Wallet, and the second is via debit card. For the sake of this demonstration, we'll use the Care Wallet. To do that, click on Care Wallet, click on Continue, and then the claim has been paid for. The other interface is the service tariff interface. This is where the HMO imputes the tariff or the prices for the secondary care procedures, as well as medication prices, lab investigation prices, and radiology investigation. This is also where any disputes or information required by the provider from a HMO with regards to service tariff is also sent. The HMO also has a Care Wallet from which it can make transactions. It can pay the provider. It can also see the records of all the transactions made. It shows exactly what has been paid for, including the authorization codes. It also has an access control interface where the HMO can decide which roles to give a staff. So to use this, the HMO will create a role, add staff, and then assign a role to the staff. That way, this allows for confidentiality, it allows for privacy, it allows for data security, and ensuring that only authorized staff have access to authorized sections of the HMO side of things. Thank you for viewing as we work together with industry players to co-create a platform, a single platform that will be in the interest of the HMO and providers to enable enrollees receive the best care possible and to have the best healthcare experience. Thank you.